Well, I think the most significant change that we've had to the treatment landscape is with the recent approval of Trastuzumab Deruxtecan for patients with it's across all solid tumors. What's unique about that approval is that it's for patients who have the highest level of expression of HER2, IHC3 plus. And that's a slightly different approval than the MOUNTAINEER regimen, which is approved for HER2 positive, meaning it could be IHC2 plus FISH positive or IHC3 plus RAS wild type metastatic colorectal cancer. So there's a nuanced difference between the two. It does appear that Trastuzumab Deruxtecan, at least with respect to colon cancer, appears to be at its best in patients with IHC3 plus disease. It's quite active there. We did show some data around the molecular and clinical pathologic features of response to the MOUNTAINEER regimen. And interestingly, in our data set, we were noting that several patients who had a long-term response actually had IHC2 plus disease. In fact, we have a patient who has now had an ongoing complete response for over 5 years, and that patient had IHC2 plus disease, so more medium levels of expression. So findings that you would not necessarily expect, because typically we think about the antibody drug conjugates like Trastuzumab Deruxtecan being more active where there's medium expression, but for some reason in colon cancer, that pattern is not necessarily holding, which is something that we don't totally understand yet.